walking is the best cancer prevention. It's even used in cancer treatments, and the studies, the information, the evidence is now overwhelming, and it needs to become a part of everybody's daily routine. But why walking, and why not high intensity interval training and weights and gyms? They're good too. But the one critical factor with cancer is it goes up with age, as does all the forms of chronic illness. Okay, they go up with age. And unfortunately, as people age, probably over 35, they stop going to the gym and stop doing high intensity interval training and stop doing all these other heavy duty activities. But they do keep walking, and they can keep walking if we encourage them, which is what this is about. The evidence is very, very clear. But it's not just cancer. We also know that physical activity, walking, reduces all-cause mortality, reduces your risk of a heart attack and a stroke, and lowers hypertension, which is a major factor in there. It's by far the best medicine. It reduces your risk of Alzheimer's disease, metabolic syndrome, and blood sugar regulation. It improves your bone density, and I've got lots of videos on bone density out there, so check those out. It improves your mental health, your sleep, and most importantly, walking improves your quality of life, which is what it's all about. As you get a bit older, over 35, your quality of life is really critical. So let's look at the facts and figures on cancer and physical activity and walking. Now, in most cases, they've referred to just physical activity, and that's why I'm putting in walking, because the studies that I highlight later with high intensity training and weight training are very specific and narrow, but the physical activity one, the walking one, is by far the biggest and most amount of evidence out there. And for example, there was a study in 2022 of 1.4 million people. And they found that in terms of all cancers, so across the board, all types of cancers, from breast to prostate to lung and all that, there was a 10 to 20% reduction in all cancers. So this is mortality. This is actual death from cancers. So 10 to 20% straight away. Now, you're probably going to say, when we go through some of this, there's a lot of variation in there. How come some are higher than 20? It depends on the group studying it. It depends on the countries where the study came from. For example, there are certain countries, Asia, for example, they have a much higher incidence of stomach cancer because of some of the types of foods they eat, and in some cases the inactivity. There are other countries who have higher rates of a lot of smoking, so they have a lot more lung cancer. So it varies between countries and cancers, a big variation. That's why there's variation in the studies and other factors in there too. But when we look at the studies, and these are big studies, 500,000 people up, and they've all been combined in what are often called meta-analysis. And they find that physical activity reduces the risk of breast cancer, okay, the occurrence of breast cancer, dying of breast cancer, by 10 to 30%. Colon cancer, 16 to 30%. Lung cancer, 26%. Prostate, 30%. Endometrial cancer. Gastric cancer, 22%. Bladder, 13%. Kidney, 23%. Esophageal cancer, a whopping 42%. A whopping 42%. That's huge. Myeloma and non-Hodgkin's lymphoma, 17 and 15%. So the evidence is pretty clear. They're the numbers, and they'll vary between countries and populations and age groups that get cancers, but the studies overwhelmingly show that. And they're talking about physical activity, and the most current and the most obvious physical activity that the vast majority of people do is walking. Hence my emphasis today on walking, but I'm going to show you lots of other facts and figures to do with the other ones in a moment. But when it comes to it, when they're talking about physical activity, it's important to get this. They've got some interesting terms that I'll introduce in a moment, but it talks about 150 minutes moderate activity decreases your cancer risk by about 13%. So that's 150 minutes. That's just over 20 minutes of walking or moving around or active gardening. It's moderate activity. It's not going for a jog. It's not sprinting. It's not going to the gym. Moderate activity. And 13 hours of moderate activity decreases your cancers by 27%. So that's 13 hours. That's what, over a week. That's over a week, by the way. That is just under an hour a day. And of course, that's what we all should be aiming for, to get that physical activity, again, because it reduces so many other factors and then increases our quality of life. And it's really important in all of the studies, they show a graph like this. So this is the number of cancers increase, and this is the time. So the amount of time that you do, the more activity you do, the lower the cancer rate. And so if you're getting out there and doing 1 hour, well, that's great. But if you do 2 hours a day of physical activity, then that is going to, again, dramatically, as you've seen here, reduce it further. But there is a point where you actually overtrain, and this occurs in all conditions, whether it's cardiovascular disease, Alzheimer's, mental health, sleep, and all those things, when people overtrain. And that overtraining is really, no, you're thinking, hold on, I don't have to exercise much anymore. No. It's really the professional athletes who overtrain, the people who are doing 4+ heavy duty hours a day. That's kind of the overtraining level. But under 4 hours of moderate activity, 2 hours of good physical activity, all absolutely great. And it shows that as you do more of it, up until that extreme training level, more activity time, cancers decrease. And also the general, now I'll show you some of the studies that have been done on this, because they're interesting, because they go into some of the detail and characteristics of the activity. And they find that as the cancer, in this one, the activity intensity, so if you increase your intensity of activity, you also get a benefit. So 20 minutes of fast walking is better than 20 minutes of slow walking. An hour at the gym where you're walking around and doing a lot of exercise is better than an hour at the gym talking like a lot of people do at my gym. Well, not too many people. But the cancers go up with the lower level of activity. The more activity, the lower level of cancers. But there is, again, that extreme overtraining, which happens if you get and you train too hard, too big. Then there are lots of studies showing that it puts too much pressure on the body, and it reverses lots of the benefits out there. So that's a brief summary of how it's all going to work, and I'll go into some more detail. But I also want to introduce you to the idea of cancer treatment. And I know that people, when they've had cancer treatment, one of the hardest things to do is get back on board and get back doing things. And you say, well, I was physically active and I ate well and I developed cancer. Well, there are lots of factors in cancer. There's 101 factors and we don't know them all, but we do understand some of the big issues like this one. Walking and physical activity is shown to have huge benefits in cancer treatment as well. So once people have developed a cancer, the addition of extra exercise or increasing exercise or starting exercise shows dramatic improvements in the survival rate and the return of cancer. And the best evidence comes from breast, colorectal and prostate cancer. When you exercise, you reduce the risk of it, but when you exercise after the cancer, you lower that risk as well. And it shows up not just for breast, colorectal and prostate, but all of these cancers are reduced post-treatment. So you've got the cancer, you've had treatment, and increasing your exercise shows to be dramatic improvement. And the best example was one I found on aggressive prostate cancer. And they had, these are the people who exercised before they got the cancer. If they continued to exercise, then they still had a 21% reduction compared to those who weren't doing the physical activity. In the people who took up exercise after the diagnosis and treatment with cancer, they had a 35% reduction in the risk of them redeveloping cancer. That's a whopping 35% reduction. So it's really saying that the best thing you can do is be physically active all the way, because it reduces your risk of developing it. And then whether you exercise or not, after the treatment, you start exercising or you continue exercising. And the studies, again, in a big meta-analysis in 2020 of all cancer types and so on, they looked at cancer survivors, and they found that if you exercise after your treatment, there was a 24% reduction in all cancer mortality. So it's across the board, all different types of cancers. Some people will often develop or can develop other cancers alongside their pre-existing or previous cancer. And a 48% decrease in cancer reoccurrence showing up. So the overwhelming evidence here is that you need to be physically active, walking a lot more, or doing whatever you want to reduce your risk of cancer and improve your cancer treatment outcomes. while there's no doubt about the benefits of walking and physical activity and exercise in reducing the cancer risk, they also have found that essentially there's no lower limit of the physical activity. In other words, even a little bit of physical activity every single day has a little bit of a benefit in terms of cancer reduction and outcomes in terms of cancer treatments. Of course, the more you do, the better it is. And that's what we're emphasizing here. But start small if you have to, just keep doing it and doing it. And then we can also find that the studies indicate cardiopulmonary fitness, the fitness of your heart to be able to pump all the blood around during exercise and physical activity, is a pretty good indicator of your success and outcomes with cancer treatments and a reduction in your cancer risk. So it's a bit of an indicator of your exercise ability, your physical activity ability, and of cancers therefore. And the question then arises, what are some of the factors? Why does exercise have such a profound effect? Why does physical activity, why does walking have such a profound effect on reduction of cancers? And here are some of the reasons that they've come up with. Now, the Warburg effect, I won't go into it, but that's where the cancer cells in particular produce an acid environment around them. And what appears to happen is intensive exercise can swap that Warburg effect around to normal metabolism again to slow the cancer down. Now, we've seen the same thing with melatonin, which I'm sure you've seen some of my videos on this. And the Warburg effect is a characteristic of all cancer cells. And everyone knows it's acidosis, an acidic producing cell, and it swaps it around. More on that in my other videos. Then you've got insulin resistance, which is well known, diabetes and high GI, all those things linked with cancers, and it reduces that. It lowers some of the sex hormones by increasing the sex hormone binding globulin. It alters it and varies it. And that's particularly apparent in sex hormone dependent cancers, e.g. breast cancer in some cases. And then you've got insulin-like growth factor, inflammatory cytokines like inflammation, like CRP, C-reactive protein, which is the best indicator, or one of the best indicators of inflammation. It increases blood flow, oxygen, which of course is thought to have an effect on the cell's ability to metabolize properly or under the Warburg effect. Improved immune function, the surveillance of the immune function's ability to look around and find the cancer cells and to attack them with the various layers of the immune system. That function improves. And then peptides, which are kind of the breakdown parts of proteins, and these have been shown to have some effectiveness. RNA molecules and myokines, which are literally just saying some chemicals, dozens of chemicals that are produced in the muscles. And these are specifically produced in the muscle, go around the body and have lots of effects, including how we feel and how we think. But in this case, perhaps reducing cancer. Now, there's not one of these which is the answer, but it's a combination of all these and many other factors too, including recently they've discovered that there are exercise sensitive genes in the prostate cells which may have a role in reducing the risk of prostate cancer through exercise. So that's a new thought that's come out, some genes that may be playing a role in there. Now, we also know that physical activity can alter weight, or can have an influence, a positive influence on weight control. That may be another factor. Gut microbiome. Exercise is one of the biggest factors in improving your gut microbiome. Now, I'm telling everyone, go out and eat well, eat the mixed fibers, make sure you take probiotics and probiotic fermented foods, but also, if you really want a healthy gut microbiome, you need to exercise. Exercise and physical activity and walk. And of course, exercise and physical activity and walking lead to a positive mental attitude. And that we know can have a positive outcome too. So we've got those factors. Then we look at the mice studies, and the mice studies are really interesting because they're showing that there is something in the blood of humans after they exercise and mice after they exercise that lowers it. And the first studies were basically done where they got mice on a treadmill, getting them running around again, and they take some of the blood from them, they put them in a test tube, so to speak, and they find that compared to the pre-exercise blood, decreases the tumor growth. So it slows it down and even stops the tumor growth. So again, something in the blood of the exercising mice. And in the experiment where they had exercise blood, so the mice exercising led to a 30% decrease in prostate cancer cells and equivalent breast cancer and colon and lung cancer as well. So we're showing that something in the blood is working effectively. And in this study, they actually got human serum, so not the whole blood, the liquidy part in there, and they got the people to exercise, and then they took it out of the exercises, the men who were exercising, or the people who were exercising and walking and stretching and doing those things, and they put them into the mice, and the tumours declined. So the human sera, the liquid in the blood, decreased when it was injected into the mice, decreased the tumours, compared to if they just did it from humans who had not been exercising. So again, emphasizing the role of exercise, changing something in the blood. We don't know exactly which combination or other things that it is. And they found that the most benefit came at around about up to 2 hours. So 2 hours post-exercise, more intensive exercise, the more impact it seemed to have had. And 2 hours up to the exercise. And then in some cases lasted 24 hours, some don't, but 2 hours after, you get this anti-cancer effect as a result of the exercise. In a large study of osteoporosis patients and walking, they found that a slow walk led to a reduction in cancers by 13%. Wow, that's pretty good, isn't it? The study also showed that a brisk walk greater than 1 meter per second led to a reduction of 45%. Wow, that's huge in all cancers, and specifically a 43% reduction in lung cancer. That's pretty good, huge numbers. That's pretty good reductions in cancer as a result of brisk walking. They also found that it led to a lowering of inflammation, which is one of the driving forces of chronic illness, including cancers. In a study of 571 men after diagnosis with cancer, they found that brisk walking led to a 48% decrease in mortality in the time frame of the study. Wow, again, how powerful is that? Getting out and having a brisk walk. Then when we look at some of the different types of exercises and things where studies have been done, they found that cycling pretty well gives you the same benefit as walking. In this case, the study showed there was a 16% reduction in cancer mortality and an 11% decrease in cancer incidence. In the same study, they found that walking provided an 11% decrease in cancer incidence as well. So the same benefits as walking. You're going to say, well, hold on, how does that compare to these numbers? Remember, those were patients already diagnosed with cancer who took up exercise. Then we go to something like high intensity interval training. And unfortunately, there are no big studies of humans, but we do have studies on rats. And in the studies on rats, they showed, again, similar benefits. In the rats, it increased lifespan. Now, you've already probably seen my video on exercise and lifespan, how it contributes to lifespan in humans and all the studies in that. I'd really recommend you check that out straight after you've seen this video. And it increases lifespan by 2.8 times. Now, it doesn't do that for humans, but it is a dramatic increase in lifespan. It decreased the tumour mass by 10% and a 34% decrease in cancer incidence. But what was also interesting in this study, each of the studies look at different little subtleties in there. And in this case, they looked at the altered glucose and glutamine metabolism. And those are the two foods that feed, the two substances that feed cancers. So it's glucose. If you cut it down, the cancers then tend to feed on glutamine. Glutamine, yep, cut that down. And what happens when you exercise, it cuts both of them down and it improves it. In another study, mice, it decreased lung cancers, lung tumours, and it also decreased, or there were no metastases. So it didn't spread around the body. So lots of benefits shown in the animal studies. When we look at resistance training, the only studies I could really find were looking after people had already been diagnosed with cancer. So again, during their treatment, they've taken up exercise. And while there are no numbers, it showed huge benefits in terms of the quality of life. For example, an increase in muscle strength, and this is resistance training, specifically this study. So they're getting out and lifting weight or moving rubber bands around and things like that. Increased muscle strength and mobility. It decreased fatigue and pain, even though the actual exercise itself may be inducing a little bit of pain and fatigue. The overall outcome is reduced pain during the day and at other times. An increase in the quality of life, a decrease in the side effects of the chemo, a decrease in bone loss, which is characteristic of chemotherapy and radiotherapy, improved anxiety and depression, and a decrease in lymphedema. So lots of the side effects of the actual treatment itself, the chemo and the radio, they were all minimized and the quality of life was improved. Despite the fact that these studies show an improvement in cancer survival outcomes and a reduction in cancer rates with that little bit of extra exercise, the great thing about walking is we can all do it, or virtually 99 point something percent. With the exception of people with disabilities, everyone can walk a little bit further and a little bit faster, and it helps the overall mortality. And I highlight this with basically just showing gym membership. Now, this is a characteristic of most Western countries. You've got the peak gym membership. These are the age categories here, and this is the percentage of membership. Now, membership does not mean going to the gym, and it doesn't mean doing weights necessarily. It's the people doing the programs and the cycling in the gym and doing all these other things, as well as weight-bearing exercise. And it basically shows that it goes up till about 18 to 24, then it slowly declines as we get to 35 and 44 years of age, 17%, 45 and 54. Oh, that's interesting, isn't it? Because cancer is an age-dependent disease. So what we want to do is increase the exercise, not decrease it. 55 to 64-year-olds, 10% have gym memberships, and for the 65 plus, 6%. And that's me, of course, I'm over 65, and I don't see many people in my age category at the gym. I normally relate to the 41-year-olds. That's up here in that category. So you might be able to double that number, but it's still only 12% membership, so maybe 10% going to the gym. What we're after is something that's going to work during that cancer, so we can continue to reduce cancer all our lives. And when we see the cancer rates and mortality, the cancer rates for the 15 to 39-year-old category is 0.79%. That's less than 1%. And remember, these are the highest areas of gym membership. And then when we get to the 40 to 64-year-old group, 27% mortality. So the rates of cancer go up a lot, much more. So of all the cancer, these add up to 100, and for the 65 plus, 72% of the deaths related to cancer are in the 65 age group. So what we want to do is increase this exercise, not decrease it. That's where walking comes into it. And when you look at walking characteristics, the studies that show that people who walk for their physical activity increase as we age, which is what we want, and we want to increase it even further. We want to get everybody out there walking. And in the 18 to 54-year-old, that's 19% actually do walking as a physical activity. Now, they're probably going to the gym and doing other things and running around and doing lots of busy things. 55 to 64-year-olds, that's 51%, and at 65 plus, it goes up 57.4%. Of those people do physical activity, their main physical activity is walking. So it shows why walking is characteristically a much better area to focus on and has many more benefits than recommending people go to the gym, because we can all do it, as I've already said. Again, most of us. So get out there, walk, reduce your risk of cancer, heart attacks, strokes, all the cardiovascular, all of those other conditions, and reduce your risks of cancer. And if you do get cancer and you know people, tell them to get out there walking, because the evidence is overwhelmingly beneficial. Now, make sure you subscribe to my channel, tick the boxes like, and pass on some comments.